Which of the following is the most appropriate response for a medical assistant when a patient expresses fear about a scheduled procedure? So option A says, don't worry, it's a very routine procedure. Most patients don't even feel a thing. And at first glance, this might seem like a good response. However, if you're saying don't worry, that's kind of implying that it's wrong for the patient to feel worried, that, oh, you feel this way, but you shouldn't. That's wrong for you to have this emotion. And to say most patients don't even feel a thing, we're not sure exactly what procedure we're talking about here, but that might not actually be true depending what it is. You might feel a little discomfort. Maybe it will hurt a little bit depending whatever procedure is being done. So we don't want to be dishonest with our patients if that's the case. So it seems like there's probably a better choice here. So let's eliminate option A. Option B says, I understand your concern. Okay, this is starting out all right. The doctor will be happy to answer any questions you have about the procedure. However, that's not acknowledging the part that's bothering the patient here. We're expressing that the patient is afraid. They're feeling worried about the procedure. And that doesn't necessarily indicate that they have additional questions when it's saying happy to answer questions. Sometimes you can have all the information in the world, all of your questions answered, but you still feel worried about something because you might just be concerned, how will it feel? What will my recovery be like? Even if you're not afraid necessarily of, oh, will this be successful or what are my risks? You might have all the answers to that, but you still might feel worried. So this isn't really addressing that part. So let's eliminate option B. Option C says, it's completely normal to feel anxious before a procedure. Let's discuss some relaxation techniques that might help. And this option is great for two reasons here. One, it's saying completely normal. And that's a big check. Patients want normalcy. They're always worried, is this abnormal? Is something bad going to happen? And they just love feeling that validation and knowing that, oh, okay, it's normal that I feel this way. That's good. So you're validating their feelings there. And then by discussing the relaxation techniques, you're addressing the problem at hand, which is that the patient feels fear. They're not expressing that they have concerns about the procedure. They're not expressing questions for the procedure. They're expressing being afraid. And then you're focusing on that and trying to help by mentioning the relaxation techniques. So we're going to go with option C. This is a good choice. But let's just take a look at option D here. Option D says, I can see you're nervous. So, okay, maybe. Would you like me to reschedule your appointment for a later date? So now, I can see you're nervous could go two ways, because if you're saying, oh, I see you're nervous, that, depending on the tone you say it in, that could kind of make the patient uncomfortable. Like, oh, they see I'm nervous. Or it could kind of be good, like, depending on the tone. Like, oh, I see you're worried. I see you have concerns. But what we're focusing on is what comes after there. When it's saying, would you like me to reschedule your appointment? If you're rescheduling the appointment, one, that's being a little dismissive of the feelings. Two, that's kind of just making the decision for the patient, oh, you're not ready, let's do it another time. Meaning that if they feel this way, that they can't have the procedure. And lastly, that also doesn't really address the problem at hand, because if you're going to reschedule the procedure to another time, that's not to say the patient's not going to feel afraid and anxious at the new date also. And then you still haven't solved the problem. Then you might have to keep rescheduling again under the logic of rescheduling when they're nervous. So option D wouldn't be appropriate. We'll eliminate that. So that leaves us with option C, validating that this is a completely normal feeling for the patient to have, and offering some relaxation techniques to help the patient. And this is all within the scope of the medical assistant's scope of practice. So option C is the correct choice here.